to hopefully maybe help you think a little bit differently about what the future possibilities are for healthcare and medicine across the spectrum, from wellness to diagnostics to therapy. And it's a really pretty interesting time. And a lot of you are enabling a lot of the technologies that are taking us into the future of healthcare. But before we go into the future a bit, I thought we'd take a look back to the future. I was lucky to do medical school up the road at Stanford and then do my training in Boston at Massachusetts General Hospital. And I had a chance to go back and visit MGH about a year or so ago for the 200th anniversary of Mass General. That's really old for places in the US at least. So had a chance to reunite with some of the house staff that I trained with. These are the guys and girls who were in the trenches with before these 80-hour work week restrictions that they have now in hospitals. Being in Boston, like many of you have visited, we could joke about walking uphill both ways in the snow. And I found myself after one of the receptions at Mass General, one of the most famous spots of American healthcare history. This is called the Ether Dome. This is where in 1846, this is the very lucky first patient ever to get general anesthesia with a surgery. Before that, they literally had to bite the bullet. And if you go back to the Ether Dome today, it's pretty much frozen in time. You can still see the actual sponge that ether was in the case. They must have done this before the FDA. And it's a shrine, and the room is kind of frozen in time. I wandered down the hall about, 4 minutes away to the ward where I spent my first month as a brand new doctor. And to my shock and dismay, that was still frozen in time from the mid-90s. The same alarms were beeping, some of the same nurses, maybe some of the same patients. The only difference was that the young doctor there was pushing around probably a 10-year-old computer, had to print out the electronic medical record and put it in the paper chart, and they're still faxing orders back and forth for the pharmacy. And I'm thinking, this isn't man's greatest hospital, MGH, but we're still practicing healthcare in many ways like we've done since 1846, based on old silos and old definitions of health and medicine. And we're now in this new connected, digital, exponential age. We shouldn't be spending 3 hours waiting in waiting rooms, right? We should start reframing and rethinking healthcare as not just being a bucket of body parts or specialty ologies. We have an opportunity again to rethink it. And we need to use technologies, like many of those that you are working on, to address some of the huge challenges we have in healthcare across the planet. The aging demographic, 10,000 baby boomers in the US turning 65 every day. The huge costs, we're at 18% of our GDP in the United States. Access to care, no matter what you think about Obamacare, we still have a very large number of Americans who don't have access to primary care. There's a shortage of primary care docs and specialists in many parts of the country. The way we practice medicine is different at Boston than at Stanford for the same case. And we're, as you know, in the era now of big data, but it's not often big information. It's not always information we can use. And of course, the information we do get is very fragmented. We're filling out those HIPAA forms over multiple times. And so there's an opportunity, I think, to change things, though we do have the constraints, unlike when you guys might build an app or a new device, of our friends at the FDA, who aren't keeping up with technology, and our friends, the payers, who actually pay for technology. So there's challenges there. But there's real opportunity, because today we kind of practice, as physicians, sick care, not necessarily health care. Our incentives are usually, as doctors, not where the evidence is, but where the reimbursement is. And the reimbursement is now on the right side of the slide. We spend 80% of our healthcare dollar on the 20% of the patients often with chronic and advanced disease. And if we start to use our technologies and the incentives shift to keeping ourselves healthier, both individually and as healthcare systems, that can make a huge difference. And I think technology and a lot of electronics can play a role in that. Another meta trend is, where's healthcare happening? Traditionally, it's in the hospital, intensive care unit, but increasingly the pressures are to discharge patients from the hospital sooner, to get them to less skilled facilities, into the home faster, and the technology is following that trajectory, even onto our own bodies. And I'll show you some examples of that. Now, since I came back to Stanford about 12 years ago for fellowships in hematology and oncology, a lot of stuff has happened. You guys have been making a lot of this happen. We've reinvented many realms. Many things are moving at what I'll call exponential rates. Linear is when you think, our minds tend to think linearly. I think if I took 30 linear steps, 1, 2, 3, 4, 5, I'd be to the door. But if I take 30 exponential steps, doubling, 2, 4, 8, 16, 32, 64, at 15 steps, I'm at about 30,000 steps. But at 30 steps, boom, I'm at 1 billion. And our brains don't often appreciate that power of exponentials, but that's where the opportunity for stress and disruption is. And you're all familiar, especially in this crowd, with exponentials. That's why with Moore's law, this is why our smartphones now have about 1 billion times the price and speed performance of the best supercomputers from MIT in the 70s. Your tablets, your iPads are about the equivalent of a Cray supercomputer from the late 80s. So that's obviously a disruptive technology in our pockets, and it's not any one of these technologies that's going to really start shifting healthcare and medicine. It's the convergence of those. It's the bringing together of big data and mobile and AI and robotics, 3D printing. All those things are converging and are enabling us to rethink and reinvent medicine. Just like many of you have been involved in rethinking technologies, like the fact that we now read more ebooks than we do regular books. Amazon sells more ebooks than regular books. So that's disrupting the field of reading and education. We've disrupted the world of photography. Kodak has had its Kodak moment. You may not recall, but Kodak actually invented digital photography. And they thought, oh, we don't want to cut into our film sales. But what happened? Last year they were essentially bankrupt, and 12 kids in a garage in Palo Alto sold Instagram for $1 billion. So if you're not paying attention to the pace of exponential change, you can be disrupted or be the disruptor. And you're seeing that, from Netflix disrupting Blockbuster to, those of you who use Uber Cab, it's disrupting the taxi world. All those things are being reinvented. What can we rethink and reinvent in healthcare? Well, one technology that's moving at faster than Moore's law in healthcare is human genomics. Has anyone here had their genetics tested in any sort of way, sequenced or a little bit? Maybe if you've done like 23andMe. So the price of sequencing your whole genome now has dropped at twice the rate of Moore's law. It's down to about $2,000 or $3,000. And you can even just spit in a tube now for $99 and get about 1.5 million base pairs of your DNA analyzed. That gives you a lot of insight to your genealogy, to your risk of diseases. Some of it can be done on USB-based devices. Here's my friend Raymond McCauley with his genome on a disk drive. And we still don't know as doctors what to do when a patient presents with their genome, but we're starting to get smarter about that. And that's a exponential technology in play, but it's not just our genomes that are getting accessible. Soon we'll be at a $100 genome within about 2 or 3 years, but it's our proteome, all the biomarkers from our blood, environmental data, clinical imagery, biomarkers, our microbiome, the bugs in our gut are playing an increasingly important role, as we're discovering, in things like inflammatory bowel disease and maybe even obesity. So there's a new, not so sexy idea of doing fecal transplants. We won't go into that, but that's coming, right? And we can even measure our telomere lengths, which have to do with longevity. So lots of this new information and data is coming to our fingertips at lower price points. And with Moore's law, in the medical world, it's really starting to impact the world of imaging. Now, through a tablet and based on streaming from the cloud, I can reconstruct my patient's data. And if I'm a surgeon, find where the tumor is and avoid the blood vessels and do what used to take, days or weeks of computation to do, now almost done instantly on the fly. So computational speeds are disrupting the way we do operations and interventions. It's changing the world of neuroscience. So now we can not only appreciate the amazing anatomy of the brain, but what's called the connectome, how our parts are put together, how that might impact our psychiatric diseases and beyond. There's a new Obama initiative to map the connectome in the brain. So we'll have more and more power to understand neuropsychology and neuroscience as well. For the cardiology world, the old-fashioned angiogram, someone has a heart attack, and we have some narrowing, we put in a stent. We still do that with a dye and a needle up the groin. That's being disrupted by high-speed cloud-based computing, because now with a 30-second CT scan, as this company out of Stanford has done, we can send that data to the cloud, analyze the narrowing of the blood vessel, what's called FFRCT, fractional flow reserve. Now it's measured computationally. And you can see how narrow it is, and now we can personalize that patient's therapy. What kind of stent might they need? Maybe even 3D print the stent to match that patient. So that's going to change the realm of cardiology, and other technologies that are common, like the ultrasound, are going to be disrupted as well. A startup I advise called Morpheus has a way of doing a 10-minute cardiac MRI, sending that down to the cloud. You not only get your anatomy back, but the function of your heart and the valves, and understand all its function and beyond. So we're changing our way we can see inside our bodies and quantify it in new, powerful ways. Now, of course, technology is now becoming accessible to us as patients. The new drug is sort of the engaged patient. And essentially, we now have medical technologies in our pocket. You've been part of this realm. 10 years ago, Palm Pilot was the sexiest thing on the market. Now, of course, we're in the tablet era and the smartphone era. Smartphones have only really been out for, 5 years now? Tablets have only been out for about 3.5. And those have been disruptive. About 70% of US doctors take an iPad to work every day. Every medical student at Stanford gets their iPad their first day of school loaded with a curriculum. So these are changing the way the digital natives use information, but also can be disruptive in the developing world. How much would you guess is the cheapest Android tablet sold on the market today? It's in India. And today it's $35. This is almost disposable. And it's not the fastest Samsung Galaxy, but it works and does all the things it does. And for a $35 tablet, think of its uses across the planet in education and in all sorts of realms that could be leveraged into healthcare and beyond. So it's not just the smartphones being communication platforms are now becoming diagnostic platforms. This is one with the glucometer built into a smartphone. So you can measure your blood glucose if you're diabetic and see that information on a dashboard. And this idea of having a dashboard and a feedback loop to your information, whether it's your steps or your glucose, can dramatically impact the outcomes in diabetes, for example. One company just made it a little bit of a game. You could essentially connect, write down your blood sugar on your phone, communicate to their doctor, they could adjust your meds, and they lowered your average blood sugar by 2 percentage points. So it's actually huge, bigger than any blockbuster drug. So soon, we'll start prescribing apps and devices and improve our exercise and beyond instead of just drugs and common approaches. So I might be, again, prescribing you an app instead of just a drug or device. That's sort of the melding of these realms. Particularly, we can have sensors embedded in your smartphones. And more of these sensors are coming to our phones and making it sometimes engaging. The idea of gamifying health, giving yourself points for healthy activities, connecting devices like the Microsoft Kinect, which is now being hacked for things like physical therapy. Most people don't like to do their PT, but now you can make it engaging and fun and track the patient, so they have a feedback loop. We're leveraging digital data across the realm, this idea of digital health, digital connected health, not just vital sign data, but all sorts of information, much of which can come from our smart devices, right? You can use the camera to look at skin lesions and diagnose melanoma. iNetra out of MIT has a sensor to look at your eye and do basic eye diagnostics. You can put an EKG sensor on the back of the phone. This is a company called AliveCore. You basically hold your phone and you get a live EKG. And with that, here's a live EKG on my phone. That could be transmitted to your doctor. If you're a heart patient, you could have that at home instead of going to the emergency room. So this is bringing us to a world of what's called a movement out of the Bay Area called quantified self, which now is turning into quantified health with all these new cheap sensors, scales that will tweak your weight, blood pressure cuffs that you can utilize to track your blood pressure and hypertension. I'm wearing a tracking device called the Basis Watch. It not only tracks my steps and tells time, but has a pulse oximeter. It can track my heart rate and my sweat and other elements. So all these things are coming together to connect our healthcare in new ways and engage you as a patient. So